Jay. Welcome to Mvskoke Radio, your weekly source for tribal and community news, interesting guests and discussions, plus a local events calendar. It's Jay, Stone Go, Gary Fife, Jahu Jifkados, Mvskoke Radio, Mabo Edget Wedskis. Welcome to our program here from beautiful, cloudy downtown Okmulgee. We have one subject today, and it's one that's commanding the national and international headlines, coronavirus, or as it's been called, COVID-19. I believe it's developed a new name there. We're going to be talking about the subject, what it is, where it is, how does it happen, and a number of things like that, and to keep it an informative session that will hopefully answer a lot of questions and prevent some others. But we'll be tackling that. Now, joining us here in the studio, we have Andy Peters and Shanine Ross, right? Okay. From our Mvskoke Tribal Health Department, and on the line from the Oklahoma State Department of Health, we have Mr. Anthony Lee. Mr. Lee, are you there with us?
Yes, good morning.
Okay, good. We're just going to get kicked off here. We want to thank you all for helping us here. The State Department of Public Information was a great help. Our own tribal sources here, Secretary Terry and Rhonda Beaver and Dr. Beats all contributed to getting us our resource people. So we thank them for coming in on the kind of short notice, but we think that the importance of the subject pretty well demands it. So first of all, we'd like to start off with kind of a basic question. What is the coronavirus? And we'll go from there. So perhaps, Mr. Lee, would you like to start us off there?
Sure, yes, yeah. So the coronavirus disease 2019, or it's also known as COVID-19, it's a new virus that was identified as a cause of an outbreak of respiratory illness that was first detected in Wuhan, China, and then now it's continuing to expand to other countries, including the United States, and it causes symptoms like a fever, cough, difficulty breathing.
That sounds remarkably like the flu or a very bad cold. Similarities there?
Yes, the symptoms are very similar.
Okay, and we hope that people would not, hopefully, mistake one for the other. Now, I understand there are a number of fatalities around the world and even here within the United States borders. Do you have perhaps the latest status report on what's going on here?
Yes. So there's been over 94,000 cases worldwide, over 3,200 deaths, and the death rate is estimated to be about 3.4%. And there's been over 80 countries with cases, and there's been 124 confirmed cases here in the U.S. with 9 deaths, and all 9 U.S. deaths have been in Washington State.
All right. Now, I understand we just got a late breaking bulletin that there was a prominent businessman who had visited that area and kind of walked around the city of Seattle, and there we go. So that's unconfirmed, of course, but that's probably going to be investigated, I would presume. Now, let's turn to our tribal sources here. Ms. Peters, now, how is the tribe reacting to news of what could be working into a, quote, pandemic, unquote?
Okay, well, the Department of Health has been preparing for this since January. We are following the Centers for Disease Control and Oklahoma State Department of Health guidelines, which is basically we triage patients. When they come in our door, we identify, which means anyone that enters, we ask about symptoms, we ask about travel. If that person has traveled or has the respiratory symptoms, then we immediately isolate, get a more detailed history, and then we call the Oklahoma State Department of Health epidemiologist. We go through a series of questions, and they will determine from that point whether or not we treat this patient as a patient under investigation.
When you ask about travel, is that similar to what people might have been used to when they visited the doctor's office and they've been asked if they've traveled outside the U.S.? And I remember that kind of being a thing with Ebola and things like that.
That's correct.
Okay, so that's kind of something that people are kind of used to when they visit the doctor's office. And I probably need to introduce myself. I'm Angel Ellis, reporter at Mvskoke Media. But
The task I forgot to do.
yeah, so it's something that's not uncommon. And how important is that identification of travel? Is that the major component for helping health officials distinguish between, something that might be common cold or something that needs to be looked at more?
We definitely want to identify that person as soon as possible. So we have a list of areas that the State Department puts out, or CDC. So when we're doing our assessment, we get a detailed travel history.
Now, Ms. Ross, you play a part in the overall scene also, correct?
Yes, that's correct. As Andi was discussing, we work with the entire health system to make sure that we have processes in place, just like she described, in all of our hospitals and clinics. So regardless of where a patient may enter the health system, they're going to go through the same screening process.
Okay, now where would you say you are in your end of the business, so to speak?
As Andi mentioned, we've been working on putting these processes in place since January. So part of that has been taking place since January. Obviously, we've also been working to get inventory, making sure that we have masks and other personal protective equipment on hand in order to make sure our staff are protected as well as our patients. And we're also making sure that we communicate to Creek citizens and our patients about what's going on. So we're doing education through social media posts and press releases and public service announcements and communications like today, coming to visit with you.
Is there anything that makes it particularly, is it, some IHS facilities are going to strictly serve Native populations. Some of our health facilities are serving communities. So is there anything that's about that makes you have to ramp up your preparations? Do you need extra equipment or extra, supplies? Has that been a preparation too?
Not necessarily. We do serve the community, but a lot of the supply, basically what we look at is over the last 3 months, how many masks have we used? How many different pieces of personal protective equipment have we used? And on average, what do we need to keep on hand? Okay. So we base that on an average par level, and so that's how we're calculating what our need might be.
So you kind of have a grasp of what the numbers that come through your facilities are.
That's correct.
And you prepare based on that.
Yes.
We see all the news photos and stories about people around the world, and they're all wearing masks, black ones, white ones, whatever. And I think I saw a question of whether these masks, these particular masks, are actually that effective. It may be just psychological, but if people have to have them, is it going to be a real preventative measure, do you think, Ms. Peters, Mr. Lee?
Yes, currently it's not recommended for people who are well to wear a face mask to protect themselves from any sort of respiratory disease, including COVID-19. And so really face masks are really just recommended to be used by people who may have symptoms of COVID-19 to spread to help prevent the spread of disease to others. And of course, face masks are really essential for healthcare workers to use when they're taking healthcare workers and for people who are taking care of somebody who's sick in a close setting.
Are these being in any way recommended by any of our agencies, the tribal or the state or even the feds? You have to have them kind of thing, or if you don't have one, you're probably going to be okay, unless...
Like Mr. Lee said, the public is not, it's not a recommendation for the public. Our priority is putting that mask on a patient that has symptoms, and then our healthcare workers wearing a N95 if they are in the room with a patient showing symptoms.
So I got a question for Mr. Lee. Could you kind of explain, like, for the broad Oklahoma standpoint, like, where are we at? Have we had anyone positive? Has anyone been confirmed with the illness in Oklahoma? Where is Oklahoma at right now?
Sure. Yes. I mean, so to date we've had 6 persons under investigation, and so 5 have tested negative, and 1 is pending test results from the CDC.
Okay. And for our listeners who are following along and wondering how to keep healthy and everything, what is the recommendation as we see the possibility of people, coming up and maybe being asymptomatic with COVID? Like, what is the number one thing just the public can do just to be aware and remain healthy?
The number one thing that we try to educate the public on is, of course, washing your hands with soap and water for at least 20 seconds. And if you don't have soap and water available, use an alcohol-based hand rub that is at least 60% alcohol. Avoid touching your face, your nose, your eyes, your mouth. Avoid close contact with people who may be showing symptoms. This is also still flu season, so the same precautions go for the flu.
Sounds a lot like what my grandma tells me about just avoiding getting colds and flu in general.
Right.
Yeah.
Would something like these hand sanitizers be useful in these cases? And avoiding contact with, doorknobs or whatever else?
Yes, doorknobs are a high-touch surface, so clean those areas, disinfect them frequently. If you're not able to wash your hands with soap and water, use the alcohol-based hand sanitizers.
Okay, so you can probably carry your sanitizer around just as if you feel the need to do something extra to avoid. Yeah, carry that around and use it as you go through your day. Thinking about precautionary measures for public places, I'm thinking now we might need to pay a little extra attention to our doorknobs at the office. Occasionally wipe those down, probably wouldn't hurt. What about schools? Are those going to be high traffic areas where I'm wondering now if my poor students' support staff are kind of freaking out and doing a little bit of extra cleaning right now?
Yes, I believe some schools may be. Where we are actually, I'm sorry, this is Anthony from the State Health Department. Yes, we are working on putting out our interim guidelines for schools K through 12, and so those should be ready to come out within the next couple of days or so, if not today. And so yes, I mean it's just advising schools to be prepared, to have their plans in place for if there did happen to be a case in their school. And I mean, we would definitely be working with them to to do risk assessments and to do contact investigations in terms of who may have potentially been exposed, and then we would work with them and their school system to determine whether or not there may be a need to either no longer have class in a particular classroom, or or potentially the entire school. So,
But that's not the case yet for Oklahoma.
no, definitely not. Right, no. There have been no cases in Oklahoma, and so with that, there's definitely been no community spread.
If we're being extra conscious about cleaning surfaces and things like that, is it pretty critical to follow those instructions? I know everybody just assumes I just took my sponge and washed down this counter, but what is the specific best cleaning practices if I'm going to get concerned about it and do it and prevent?
It is very important to follow what we in the healthcare field say is follow the manufacturer's guidelines, but each of you on your disinfectant can read on the back of it, and it will have a contact time or kill time that you should leave it on the surface for it to be able to kill different bacteria or viruses.
Okay.
And they're not all the same, so you might want to vary the time.
That was my next question. Is there anything specific about COVID do I need special cleaning supplies, or will my basic Clorox wipes do the job kind of thing? Has there been anything about this virus that makes it anything above and beyond what we would typically do for flu or just general cold season?
This particular virus is an emerging pathogen, so testing, they're still doing all types of testing. So right now in the healthcare field, what we are using is anything that has the label that it is EPA approved for an emerging viral pathogen.
Okay.
And now let me throw in a absolutely ridiculous question. In the last few years, Hollywood has produced a couple movies about epidemics and worldwide panic and National Guard turning out and things like that. Those movies have absolutely no usefulness in this situation. They're all Hollywood fiction, correct? And you professionals don't have to answer that if you don't want to. But nobody wants to tackle that one? No, okay. But I'm going to assume then, it was just, a vehicle for Dustin Hoffman or whoever else to make another movie. So don't panic, don't go crazy, use some common sense, enjoy the movie if you did, and move on, right?
Yes. I mean, one thing I can say is that, we are, the State Health Department is working closely with all our partners, including the tribes, to try to be as prepared as possible for whatever may occur. And so we're trying to maintain good levels of communication. We're trying to send out information as it's available, and there's been many meetings and conference calls and whatnot with the agencies across the state to just make sure we're all on the same page and working together to be prepared.
Right, that's been the message that I've heard from everyone, and I'm just delighted to hear it. Now, can any of you give us an idea of how that coordination is coming together? I'm going to assume that's federal, state, tribal, county, city. Everyone is working for the same goal there. Is there a master plan, so to speak, in there, or is it just kind of a work in progress? Anybody?
Well, as we speak, there is a conference call going on between local, state partners. So we, like Anthony said, we're in contact. I have an open line to the state epidemiologist. They advise the hospitals on particular situations. We have conference calls with CDC, with Oklahoma State Department of Health. We follow their guidelines. So right now we're partnering, and the communication levels are open, and I feel good about what we have.
Can I just kind of ask for I'm a layman as far as health news and information goes. How does that hierarchy flow? Is it something that on the federal level they're contacting, on the global level and getting the latest information, and then do they filter that down to the states, and then do the states come and filter that down to local medical centers? Is that how that works?
I think, and I'll go ahead and take this one. I think this day and age, we really benefit from the internet and electronic communications. Sure. The state has helped us with a COVID dashboard that shows the status, so we're able at any point in time to pull up a dashboard that shows us what's going on worldwide. I believe that information originated with the World Health Organization. The state modified it to include the Oklahoma data. And so we're able to look at that and see how many new cases are developing. It's real-time information. We, as in Andy and I and other staff, access the Centers for Disease Control website. We are members of the Oklahoma Health Alert Network. And so anytime any breaking news or updates need to come, that comes directly to our email. So there are so many forms of communication that you can tap into. Andy mentioned that we have on-call numbers for the state epidemiologist and other acute disease professionals. So telephone, email, websites, it's pretty much endless in terms of trying to look for information. We have all of those different possibilities.
So anytime there's something new, no matter where it is, you guys are privy to that information pretty quickly.
Yes.
Okay. Is that information available to the general public at this point?
The CDC and the Oklahoma State Department of Health websites, anyone can access those. Some of the other alerts are geared toward healthcare professionals. I think someone mentioned technical speak and layman speak. Some of the healthcare professional alerts are more technical terms, so that's geared toward the health professional.
But it's out there, and so if anybody's got some weird conspiracy cover-up theory, then forget it. It's right out there for anyone.
What we try to encourage when we speak with our patients and others is just take time to find a credible source. When we look at information, as we've mentioned throughout this discussion, we go to the Centers for Disease Control, we go to the Oklahoma State Department of Health. Those are two credible sources for information on COVID-19. And so as the listeners are taking notes or listening to us talk about this, that's where I would refer them to go.
Yes, and the websites for the health department's COVID-19 website is coronavirus.health.ok.gov. And for the CDC website, they can type in cdc.gov/coronavirus. Then they can click on the COVID-19 link, and that'll take them there.
Okay. Are there any, I've heard news reports coming out of Washington State. Is there any kind of, I'm not sure how to frame that with, if there's a positive test, is there a framework of what happens and how that plays out, and is any of that privileged to talk about for public consumption? If the person's going to test positive in Oklahoma, what will I start looking at, and as a parent and mom, and what do I need to know?
Yes, so if there were a positive confirmed case in Oklahoma, we would conduct I don't remember who it was that mentioned it earlier, but they would look into the contacts that are associated with that person, and then we would, looking at their travel history and things like that, and then go back to see, where they've been, and then we would then evaluate, their place of business or school or daycare or whatever that location may be, and then evaluate them, and we would be monitoring them for 14 days from their last day of exposure to see if they were to develop symptoms. And we would just work with, whichever partner it may be, that business partner or healthcare facility or whatever it may be, to try to implement control and monitoring measures.
Okay.
Let me toss this one in here. I guess I'm asking you all for your assessment of how this thing is progressing or spreading. First of all, is the spread faster or slower than anything you've seen before? And are we at a stage where we start using the term pandemic? Anybody?
I think they're leaving it to the phone.
Guess, yeah, make it up yourself. So are we dealing with a pandemic? Because we had a gentleman call the other day and canceled his newspaper subscription because he was convinced that this disease was being spread through the mail on publications and stuff like that. So he wanted us to stop his newspaper.
So I'm imagining people at home who are getting those kind of, that level of concern. Are they afraid to go to the grocery store? Are they afraid to?
Right.
And does this illness even spread that way? Would that even affect anything?
Right.
Well, as far as Oklahoma, there are no confirmed cases in Oklahoma, so there's no need to panic. We just need to continue to use the precautions of washing your hands, the same as influenza or the flu,
Mm-hmm.
same precautions as the flu. When you go to the grocery store, there's people there that may have the flu, so it's the same precautions.
I'd like to avoid that word panic if
Right.
at all possible here.
Right.
Now it takes me back to the Hollywood movies there. Now, as I say, how does this thing spread, and is this rate of spread, contagion, whatever you want to call it, is that unusual, or is that something you've never seen before? I heard the phrase, this is a new disease kind of thing, so I'm wondering if the impact is different.
Yeah, I mean it's a new virus, and it is spread like other respiratory illnesses, like just through the droplets when somebody coughs or sneezes, and so it really is that close personal contact, with somebody and with exposure to those droplets, and then when you're once you're exposed to that, and then if you touch your eyes, nose, or mouth, then you can become infected.
As we cover and watch these headlines and stuff, I know some of the information is emerging, evolving, and it's still kind of relatively new. I know, like, early on when we were watching it, they were saying that sometimes even the numbers of, infected was kind of developing. But have we got far enough into this to kind of understand with those droplets, since we know that it transfers through respiratory, like someone coughs and the little flakes in the air or whatever, can it live on surfaces? Should we be concerned? Is there any kind of data on that yet?
Last week in one of our conference calls, that question was asked, and since it is a developing or emerging virus, the data for that has not been put out or clear. We do know, again, that it's a respiratory transmission, so coughing, sneezing, and it lands on the surface, and you touch your face, any portal of entry, that can be a way to transmit.
Yeah. I understand that you touch your face about 3,000 times a day. Is that anywhere near true?
I do not know the exact number of times you touch your face, but yes, you have to be, you need to be aware of touching your face with unwashed hands.
Mm-hmm. Well, and let me go back to the spread once again. It's primarily in the Far East. It's spreading through several countries. 70, I believe, at the last count.
Over 80. Yeah.
82.
82. Oh my gosh, it's been since last night that's changed. Oh my gosh, and a number of countries are taking different steps to do what they can to control. They're closing their borders. American airlines have cut off several cities, and we're seeing this thing pop up in places that have potentially huge capability of spread. I mean, obviously the China and I understand both Koreas now, although the North isn't talking much. Italy and then other places. Now, I asked a question about pandemic once before. Now, do we have a potential here at least?
Yes.
I know this is asking people to stick their necks out a bit. But
It's WHO that makes that. The World Health Organization that makes that declaration, and so I think it's just a matter of when they really decide to put that label on it. But yeah, it is. I mean, it's definitely widespread across over 80 countries.
So when we're like talking about, I'm not even really sure what the classifications for these different kinds of things are. When I hear pandemic, I think of a video game that my kids play, and it's totally different than like what the actual scientists who are on the ground doing. But what is World Health Organization classifying this as right now? If anybody has like an answer for that, I don't know if is it just an emerging pathogen like you'd stated, or are they just saying it's a virus and everybody's just kind of watching kind of thing? Or is the classification even important, really? I mean,
yeah, I think right now it's just classified as an outbreak.
An outbreak, okay.
Yes, I believe that's true.
Okay.
well, that has a pretty strong psychological effect, I think, rather than, oh, well, it's an outbreak and it isn't this huge thing. Now, as we watch the numbers progress, enlarge and grow and things like that, my mind turned toward, is there a possible comparison to something like the epidemic of the Spanish flu early in last century, and Ebola perhaps in recent years? Is this like a little brother to something like that, so to speak, or is it growing past that state?
Is there anything specific we can compare?
Yeah.
Like the impact to, like where it's at now, it's impacting people. People might be getting sick, or people might even be thinking about changing their travel plans. Is there anything else in recent memory that's had that impact?
Well, on the CDC website, it does list the travel warnings or alerts on there.
Okay.
And when we discuss this, keep in mind that it is a respiratory type illness that the symptoms are involved with. The recovery rate on our website is 54.14%. So that I think speaks for itself.
So
there.
fatality isn't guaranteed. People are recovering, but
Right.
the ones that aren't have some sort of respiratory disease to begin with before.
Or they may have another coexisting disease.
Mm-hmm. And
Their
Right.
immune
Or
system
underlying.
may already be compromised.
right. How about age groups? I think there's some concentration looking on elders and senior citizens being more susceptible. Is that correct?
Those are the ones that where there's more severe disease and where most of the deaths are occurring.
Okay. Well, I tell you what, we're going to take a short pause here and take a break, and we'll be right back with more of our discussion on the COVID-19 diseases and how the state of Oklahoma and the Mvskoke Creek Nation Department of Health are preparing and dealing with that situation. So let me get this button punched, and we'll be right back after this.
Who am I? Am I native? I don't want people assuming things because I'm Indian. I just want to be me. But how do I live in two worlds? Some guys just check out by doing meth. But that ain't for me. Because I see my family, my friends, my drum making, my future. There are a lot of cool things about being who I am. And meth isn't one of them.
Learn more at ncai.org. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Hear that? That's the sound of hope being killed by meth. Methamphetamine use is causing huge problems in our community. Hear that? That's the sound of something you can do about it. Events like rodeo, res ball, and family time can help keep kids away from meth.
Talk to your kids. Keep our culture alive. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Learn more at ncai.org.
Okay, we're back here with Mvskoke Radio here on The Brew, 106.3 FM and 1240 AM from beautiful downtown Okmulgee. We're speaking with some of our tribal and state experts on the topic of the coronavirus, or COVID-19 as it's being called. Can somebody explain what that COVID-19 is? I mean, what does that represent?
Sure, yes. So the CO part stands for coronavirus. The VI stands for virus, and then the D stands for disease. And then the 19 is that it was first identified in 2019.
Okay, so either term is useful here in this point still?
Yes.
Okay. We have seen our actually whole world react to this. Some of them are more stringent about what they want to do, like cutting off travel between certain countries and things like that. But we've seen it actually kind of start to affect how people socially interact with each other. I mean, there's kind of jokes about not shaking hands with each other anymore, about the...
Which is kind of big for Native communities. We're kind of big on handshaking.
Yeah. Well, the German prime minister and one of their top officials didn't shake hands. We're hearing jokes about elbow bumps now, or people just kind of waving at each other. Now, this seems like then our society is paying attention to this particular topic and issue, and this challenge. Now, that represents kind of a radical move for me. I mean, personally, watching people not shaking hands or stuff like that. As Angel said, our people are huge on shaking hands. What does that represent? I mean, is the global population, I guess, getting a little weary, scared, leery of perhaps the spread of this thing? Anybody want to perhaps speculate on what you might see or what you might think? I stopped them in their tracks with that one.
I like the medical professionals. They're never big speculators.
No.
They are.
Yeah.
Ours is based upon facts.
Yeah, right.
We would
right.
just hope that would mean that the public is paying attention to hand hygiene and thinking about the risk. We hope that it's not that they don't see someone they know and that they're reluctant to speak and say hello. That it's just thinking about the surfaces they're touching and different things like that. That means that they may just be a little more cognizant of what's going on and what their risk is. Hand washing, as we've talked about, that's the most important thing. Washing your hands with soap and water. If you're able to do that, that will protect you.
And it's not that 2-second run under the sink
Exactly.
thing. It's not that. That's not how it's done.
Exactly. So just protecting yourself and proper respiratory hygiene too. Knowing how to cough and cough safely, when you're in a group of people, not to expose them. That will also protect you and others.
That would mean turning your head in a, quote, safe, unsafe direction, covering it, coughing toward the floor or something.
Or into your elbow. We teach to cough into
Cough
your elbow.
into your
Yeah, cough into
That's
your
correct.
sleeve. Right, yes. Mm-hmm.
You can always throw your shirt in the laundry and get it clean again.
So I kind of have a question for the state officials. When I first started watching it, I guess January-ish, it was like, okay, in China this is an issue. And you kind of felt pretty comfortable then. And, most of those health screenings were going to be like, you're feeling a little sick, you might have a fever, you've got a cough, but have you been to China? No? Well, then we're good. How has that evolved over the past several weeks as we've seen exposure in Washington. It's not necessarily Oklahoma, but I'm kind of envisioning that that makes the screening process evolve a little bit too, doesn't it?
It does in a way. I mean, because we're in terms of when it first started, we were monitoring travelers that were returning from China, and we're still continuing to do that. But in terms of the folks that are returning from the other countries where there is community transmission, the CDC is providing a little handbook when people return from those countries. And so it provides information on what to do to kind of watch themselves for symptoms, and then to contact their healthcare provider and the state health department if they were to develop symptoms, and to notify those officials that they return from a country where there is community spread, and then we would just work with them from there.
What has the CDC said about those who have been, and this is where I'm really curious about it, because like we said, it's not like you get COVID and then it's automatically assumed it's going to be a death sentence, but has the CDC learned about those recovering? How long does this recovery take? Do people get really sick, or is it, I know it's going to be compounded by other issues in their general health to begin with, but say your average mid-age, I'm 38. I'm talking about me here. Am I going to be okay? No, just kidding. But like a person my age who basically healthy, doesn't have any underlying issues, is it still going to be like a hospital stay? I'm kind of curious about what that's looked like for people who have, been infected with COVID. Do they stay in the hospital for 3, 4, 5 days? Was it an ICU thing? Was their recovery very slow? Did it affect mostly the lungs, or what did it affect, kind of thing?
Yes, I mean, since this is still a fairly new disease, most reported illnesses have ranged from mild symptoms like just fever and coughing and shortness of breath. Mm-hmm. And as mentioned a little earlier, the death rate right now is about 3.4%. So those are the extremely severe cases with some and most of them have had some sort of a underlying medical condition, as was mentioned earlier.
Mm-hmm.
Let me ask this one again. I think I know we've sort of addressed it in different forms, but what might be the red flags, the warning signs that there is a potential for someone contracting this, or perhaps even carrying it? Would there be something that a health professional might look at or want to be aware of? Things to look out for.
Again, it would be our assessment when they enter the facility. We would ask about travel, or have they had exposure with any known person that has the COVID-19, and then symptoms.
Mm-hmm.
Yeah, I would agree. We'll continue to screen anyone that comes into any of our facilities. Those will be the exact processes that we'll follow. We'll stay in touch with the state. We'll heavily rely on the state epidemiologist to give guidance, to ask further questions on the travel, and to help us determine what type of testing will need to be done with each individual patient.
Would you be the one to ask about testing? I mean, what happens when someone is going to be tested? Do you draw blood, or what?
As Andy mentioned, this protocol that we implemented, it will be the staff actually in the emergency room, mm-hmm. or the facility where the patient actually enters for care. And so that staff has been trained. Like we mentioned before, we've been working on this since January, and so that staff has been trained on exactly what to screen the patient for, and at what point should they be contacting the state epidemiologist and how to have that discussion. And so working with the state epidemiologist, they would then have more discussion with the patient and determine what needed to be done as far as testing goes.
Okay, would that include perhaps
The physician and the nursing staff, they're
Right.
at the facility. Mm-hmm.
Okay, and would either the tribe or the state or perhaps even the federal government be setting up stations where people in the public could go to find out, to take a test, to have themselves tested? Is that still off in the future?
It will just be, if someone is not feeling well, it would be just like anything else, just like if you thought you had the flu. If you've had travel, definitely that would be something that you could call in and let us know that you wanted to come in. But if, like the flu, we have a lot of our patients come in through the ER. We definitely have processes in place to screen our patients regardless of what facility they would come into. But if someone, had traveled or had known contact with someone with COVID-19, they could obviously contact us and come in for care.
Now, let me take that one step further. Now, earlier, Angel asked a question about, what happens, and I think the word quarantine should be kicked in here and discussed perhaps by anyone. I understand that there's like a 14-day period when a patient or potential patient would be observed. Is that correct, or what might happen during that period?
Yes, and so it would be 14 days from their last date of exposure, either to the country where there was ongoing community transmission or community spread, or last contact with a confirmed case of COVID-19.
Would that quarantine involve like staying in the hospital? Does it happen? How does quarantine really actually happen? I've seen too many movies. I'm curious about what it actually looks like. Do I need to stay home?
So if the people are not exhibiting any symptoms, then yes, they would just stay at home for those 14 days.
Okay. You've been watching NCIS, or
I'm trying to figure out how to get a 14-day vacation away from the husband and kids.
All right, go back to the office and cough a lot.
No.
The tribe has obviously begun to muster its resources. You've had cabinet-level meetings, I understand, to start to develop this plan. And as you say, Shannon, you've been working on it since last January?
This past January, that's correct.
Right, so the wheels are turning. So I guess at this point, if we were to sum up what activity we've got at the moment, I guess what should our citizens and our local community expect from the tribe?
We'll just do a recount on the, what to expect.
So as everyone knows, we continue to communicate through social media, so please follow our Facebook page. The Mvskoke Creek Nation Department of Health will continue to post education there. The educational sources we'll use will be the Centers for Disease Control and Prevention in the Oklahoma State Department of Health. As different pieces of information are released from those sources, we'll update those Facebook posts. We've already talked about the internal screening processes that we have in place within each of our health facilities. So those will continue to be utilized. We are managing our personal protective equipment inventory, just like other healthcare facilities are, so we have those processes in place. We're working with our public health staff, our public health nurses, and other nursing staff to make sure that, if a patient comes in for other types of care, that if they do have questions and they need some additional education, that those staff that encounter those patients have the most up-to-date information on COVID-19 to share with them. So that's a focus that we have as well. And we're participating, it seems like daily, but it's at least a couple times a week with our partners at the state, as Mr. Lee indicated. We're also on conference calls with the Indian Health Service. They're obviously tracking this just like we are, and they participate at the state level as well. And with the Centers for Disease Control, they also have different webinars and conference calls, so we're continuing to participate in those. So we will just continue to be as active active as we can and be proactive in making sure that our citizens are aware of what's new, and that we continue to build processes that keep our staff and our patients safe.
We'll do our part to help you out there.
We appreciate that.
I'm just kind of wanting to kind of wrap up in my mind is like, as we see, people getting sick, what does that look like for the hospital when it's trying to segregate like that type of illness from just your average everyday, I need to get my gallbladder checked out?
That's a good question. We are in the business of taking care of people,
Yeah.
so that's what we do.
Yeah.
This is just a different type of illness.
Mm-hmm.
So when we talk about implementing different processes, we sit down and we get the necessary disciplines in the room and we talk about how this would affect our existing patient flow. And so we make plans and arrangements, and we understand that we need certain types of rooms to put particular patient types into those rooms. So we do make accommodations for that. And we have experts like Andy that have been trained in infection control and prevention. We bring them to the table. So as I mentioned, we've been really busy since January.
Yeah, gosh.
So, and the flu's going on. So,
Yeah.
when a person has the flu, we're going to protect them and
Yeah.
protect our staff in a similar way. So, we've been making arrangements and plans for that since way back in October.
Okay, cool.
So,
Mr. Lee, same question. How is the state gearing up for this now, if you were going to sum up your activity?
Yes. Yes, we are staying connected with our federal partners and our tribal and healthcare, and actually also public partners too. And so we're just getting. We're actually, one of the things we're doing is actually reviewing our pandemic influenza plan, and so that we've prepared in the past to just sort of really help us gear towards this. And so we're reviewing that and then see what needs to be updated in preparation for when, if and when there is community spread of this COVID-19.
This question now is kind of far afield from what our professionals here concentrate on, but we're hearing stories of some economic impact because of this disease. Obviously, the airlines are going to suffer from having to cancel flights and connections. Related industries would be the travel industry, hotels, restaurants, things like that. And I'm sure there are dozens of other related ripple effect kind of things going on, but could you see something like this really having the equal of an economic wallop to different things? I know this is back in a ridiculous category here, but I think we're going to see that. Even a casino in Oregon has shut down, and they're trying to take place, and that's got to be a major hit to their economy. So anybody got a feel for the potential there, or what you've seen already? Again, I got them again.
These guys are like, we're medical people. We're not economists.
I'm not touching that. Forget it.
it would be speculation at this point.
Well, that's okay.
Right.
Absolutely.
That's free.
Right.
And I won't tell your boss.
I'm going to speculate that the soon as somebody's like, like if there's half a dozen people testing positive, I'm staying out of the mall. Just saying.
That's actually happening, believe it or not.
Yeah.
And I understand Corona beer is taking a real hit too.
Yeah, one thing I would like to say is that businesses and employers need to kind of look at their emergency plans to see. If there is community spread, they need to be prepared to look at recommending their employees stay home from work when they're ill, and then maybe looking at alternatives like teleworking and things like that.
Yeah, that's a really good little bit of knowledge, because there's some industries and some professions that they have to go on. The news is going to go out one way or another, so we have to have plans in place. So that's just something we can probably give people some insights on and let them track it down at the CDC and see what the best recommendations are. Are they making recommendations for public interaction, or do they have like a checklist for preparedness like that employers might utilize?
Actually, on the Centers for Disease website, there are some resources for businesses, as
Okay.
Mr. Lee was indicating, and there are also some different resources for schools and child care programs.
Okay, wonderful. We'll try to share those out when we get back to the office.
Those websites have excellent resources.
Well, we're going to have to wrap this up, but before we go, I'd like to offer you, each of you, a chance for like a final thought or a recommendation or something on your mind. Andy, we'll start with you.
Well, of course, with infection prevention, it would be hand hygiene. Wash your hands.
Comments? Mr. Lee?
Yes, I mean, I'd like to echo that, and then also just to pay attention to the information that is being shared from the Mvskoke Creek Nation and the State Health Department, and to really adhere to the recommendations that we're providing. So, if we're recommending someone to stay at home or whatnot, then to do that. But yes, definitely the respiratory hygiene. Hand washing and hand gel, and then also getting the flu vaccination.
Right, we can't say that enough. Ms. Ron?
And I would just add that when listening to the news, just make sure that you compare some of what the headlines say to those credible sources like the Centers for Disease Control or the Oklahoma State Department of Health. That's where you're going to find credible medical-based information.
Perfect.
Right, take the time to work that one out. Okay, well, we'd like to thank our guests, Anthony Lee from our State Department of Health, Ms. Andy Peters and Shanine Russ for stopping in and talking with us today. We appreciate their input and the time they took from their schedules to participate in this discussion. But let's get around to the favorite part of most shows people like. We have some community announcements to share.
I'm going to start with the Muskegean History Symposium. It's going to be taking place March 20th through the 21st at the Mound Building in Okmulgee. The event takes place from 8 to 5. Some of the topics that they're going to be discussing, and they have some experts who are going to be going over a lot of history. Some of the topics involve the Mississippian chiefdoms and mound centers, rise of the historic Creek Confederacy, tribal town archaeology, Creek Civil War, Battle of Horseshoe Bend, Trail of Tears, arrival at Indian Territory, American Civil War, and many, many more topics. They are going to include Alabama Coshada history, Natchez, Seminole history, Yuchi history, and it's going to be put on by the Historic and Cultural Preservation Department of Mvskoke Creek Nation. For more information, you can call 918-732-7733.
Okay, we have a formal wear drive going on with prom season coming up and celebrations for many of our young people. The Department of Education and Training is collecting new and lightly used formal wear for Mvskoke students. Dresses, suiting, and accessories are being accepted, and students who are interested in receiving this formal wear can fill out an application and set an appointment with the staff for a fitting. So for more information, call 918-732-7743.
The Mvskoke Creek Nation Program Resource Fair is taking place March 10th through April 22nd on various different days. They'll be at the different health centers, and they are going to have healthcare staff and community members invited to attend Resource Fair to learn how to connect with the Mvskoke Nation programs. For more information on all those dates and the different locations, you can contact 918-549-2557.
All right, it is tax season, and there is an income tax program, Divida program, a free tax preparation by appointment only, called the Tribal Department of Commerce, 918-549-2607 for more information or to schedule an appointment.
The adult language class is going to begin hosting a 6-week beginner's Mvskoke language class and Mvskoke language conversational class beginning March 9th. For more information, call 918-732-7649.
We're just running out of time, and I've got wild onion dinners here to do, but we're Out of time. What can I
Just
say?
look them up and go.
Yeah, Humbux Che. All right, for Angel Ellis and myself, Gary Fife, Joe Jifkados, thank you for listening to our program. You've been listening to Mvskoke Radio. Join us again next week for more local, tribal, and community news and updates. Madot.